On the 9th of March 1974, a 52-year-old man emerged from the Philippine jungle carrying a working rifle, 500 rounds of ammunition, and several hand grenades. His name was Hiroo Onoda. He had been fighting the Second World War for 29 years after it ended. Not because he was delusional, not because he was mentally ill, not because he lacked intelligence or capability, because nobody told him. The Japanese Imperial Army had issued his last orders in 1945. Hold your position, conduct guerrilla warfare, never surrender. His commanding officer disappeared. His unit disbanded. The war ended. Onoda kept fighting. He was not wrong to fight. He was following the last verified information he had received from a trusted institutional source. The institution had simply stopped communicating with him. When a researcher finally located him in 1974 and flew his original commanding officer, then a bookseller in Tokyo, to the Philippine jungle to issue the formal stand-down order, Onoda wept. Not from relief, from the weight of 29 years of correct behavior inside a false reality. Here is the question that case has been asking for 50 years, and nobody has answered cleanly. How many of us are still fighting wars that ended? Not in jungles, in the information we trust, in the official positions we have never been told have changed, in the realities maintained by institutions that stopped communicating the truth the same way the Japanese Imperial Army stopped communicating with Hiroo Onoda. Quietly, without announcement, without correction. Before the cases, we need to name the mechanism. Onoda's situation was not unique to war. It is a precise model for something that happens in peacetime, in civilian institutions, with consequences that accumulate across decades. The mechanism works like this. An institution, a government agency, a corporation, a medical body possesses information that contradicts something the public has been told. The institution does not announce the contradiction. It does not issue a correction. It does not send someone into the jungle with the stand-down order. It simply continues operating on the official position, while internal documents record a different reality. The gap between what the institution knows and what the public is told is not always malicious. Sometimes it is bureaucratic. Sometimes the correction triggers legal liability. Sometimes it is institutional inertia, an organization that has never developed a mechanism for publicly correcting itself. The result is always the same. People keep fighting. They keep taking the medication they were told was safe. They keep trusting the infrastructure they were told was tested. They keep living inside a model of reality that the institution generating it quietly stopped believing in years ago. 3 cases, each documented, each resolved eventually. The resolution in every case came too late for the people already in the jungle. Thalidomide, 1,957. A sedative, marketed heavily to pregnant women across Europe, Canada, and Australia. Its manufacturer, Chemi Grunenthal, had conducted internal studies before release that produced results concerning enough to note in internal documentation. Those documents were not public. The public position was safe for use during pregnancy. Between 1,957 and 1,961, approximately 10,000 children were born with severe limb malformations in countries where thalidomide was prescribed. The drug was withdrawn after a German pediatrician named Wedekind Lenz publicly connected the malformation pattern to the drug. In the United States, a single FDA reviewer named Frances Kelsey had repeatedly refused to approve thalidomide because she found the safety data unconvincing. She was pressured. She held. America was largely spared. The Grunenthal internal documents recording early safety concerns were not fully disclosed until litigation decades later. The institution had stopped believing its own public position before the public position had finished causing harm. Leaded gasoline, 1923 to 1986. In 1923, General Motors, Standard Oil, and DuPont introduced tetratholide as a gasoline additive. Workers at the production facilities began dying and experiencing severe neurological symptoms within the first year. A geochemist named Claire Patterson spent decades documenting that lead levels in human blood had risen in precise correlation with leaded gasoline use, and that the levels being called normal by industry-funded researchers were not natural baselines. They were contaminated ones. The industry's response was to fund competing research, question Patterson's methodology, and exclude him from advisory committees where the question was being decided. Leaded gasoline remained in use in the United States until 1986. The internal industry documents produced during the decades of public assurance show that the toxicity was understood far earlier than the public timeline of acknowledgement suggests. The Tuskegee Syphilis Study, 1932 to 1972. The United States Public Health Service enrolled 399 black men with syphilis in Macon County, Alabama, in 1932 to study the natural progression of untreated disease. The men were told they were being treated for bad blood. They were not being treated. They were being observed. When penicillin became the standard treatment for syphilis in 1947, the men in the study were not offered it. The study continued for another 25 years. The study was not secret within the Public Health Service. It was published in peer-reviewed journals throughout its duration. Dozens of physicians knew of it. It ended in 1972 when a whistleblower named Peter Buxton leaked the details to the press after being ignored through internal channels for years. The men in the study had been inside a false reality for 40 years. The institution generating that reality had never stopped knowing it was false. 3 different institutions, 3 different industries, 3 different eras. The mechanism is identical in every case. Internal knowledge diverges from public position. The divergence is not announced. People continue operating on the public position. Harm accumulates. The correction, when it finally comes, arrives from outside the institution. A pediatrician, a geochemist, a whistleblower who was ignored through internal channels first. Hiroo Onoda's stand-down order did not come from the Japanese Imperial Army. It came from a researcher who found him and a former officer located in a Tokyo bookshop. The institution does not send the correction. Someone outside it does. Eventually. I want to be precise about what I am and am not claiming. I am not telling you that every public health position is secretly contradicted by internal documents. I am not claiming that institutional silence is always deliberate deception. I am not asking you to distrust every official position on every question. What I am telling you is that the 3 cases above share a specific structural feature that is independently verifiable in each one. A documented gap between what the institution knew internally and what it told the public, confirmed by the institution's own records after the fact. That structure is not a conspiracy theory. It is a documented pattern with named cases, named documents, named dates. The question worth sitting with is present tense. What is the current institutional equivalent? There are active litigation proceedings against pharmaceutical companies involving internal communications about products currently on the market. There are ongoing regulatory disputes involving industrial compounds whose internal industry safety assessments differ from public statements. There are public health advisories whose supporting data, when requested under FOIA, arrive with sections redacted. I cannot tell you which of those becomes the next thalidomide. No one can know that yet. What I can tell you is that the structure that produced these cases is not a historical artifact. It is an institutional feature. It persists wherever institutions possess internal knowledge they are not legally or financially incentivized to share. Hiroo Onoda lived to 91. He died in 2014. In interviews after his emergence from the jungle, he was asked repeatedly whether he felt angry at the institution that had failed to reach him. He said he did not. He said his orders were clear. His execution of those orders was correct. The failure was not his. The failure was the institution's failure to close the loop it had opened. He was right. That is the most unsettling thing about his case, and every case that follows the same pattern. The people inside the false reality are not failing. They are doing exactly what they were told to do, with exactly the information they were given. The failure is always upstream. The documents that established each gap between what the manufacturers knew and what they said, between what the government was doing and what it told its subjects, are public now. They were produced during the silence. They were simply not shared until someone outside the institution decided the gap was no longer acceptable. The stand-down order always exists. The question is whether anyone carries it into the jungle before the fighting goes on long enough. And the answer, in every documented case, is the same. Someone does. Eventually. Not the institution. One person, with the document, who decided that eventually was now